Hello, my name is Joseph Werner. I'm an occupational therapist, and I have an office in Melbourne called Child and Family Consultants, where we have occupational therapists and speech therapists. And we work every day trying to help children and families who are dealing with kids who have special needs of one kind or another. I'd like to talk to you for a few minutes about communication. Communication is one of the most important things all of us can do day in and day out. Also, it's not always the easiest thing either. There's nothing that makes us more alive than being able to communicate with another person. It's a fundamental ability of all of us. All of us try to find some way of making ourselves known through some type of a signal. That signal could be a sign, a gesture, could be words. But we all want to make ourselves known, and we all want to connect with somebody else who's going to listen and pay attention to us and make us feel like who we are and what we have to say is important. Kids with special needs oftentimes have a particular difficulty in being able to express themselves, especially when it comes to using words and language. The hallmark features of having a diagnosis of autism spectrum disorder include having an impairment in social skills and in communication skills. Social skills and communication skills are really intimately linked. And if you're really struggling to be able to communicate with someone, it's almost impossible really to develop good social skills. So whenever you're working with a child or a family, communication is the first and foremost thing that has to be established and make sure that's working well for everybody. Another important thing to remember is that kids don't always use the right words at the right time and at the right place. For that matter, it's not always easy to do that, and we know as adults we don't always use the right words at the right time and the right place either. So kids really need you to model how to be able to use words and short sentences and phrases as a way of explaining and describing what is going on at the moment. Kids also need you to be able to use words to help them understand where they are in space. So for example, teaching kids up, down, in, out, under, and over. The way kids learn to do that actually is by you playing with them and by having them go through a tunnel or under a table or inside a pillowcase or under a sheet. By playing all those little hide-and-seek games, kids really begin to learn what in and out and up and down and under and over are. But the only way they can really learn that is they have to be playing with you and at the same time hearing the words. So you being able to voice those words while you're playing with your child is really a way for them to understand and learn all these spatial concepts. For that matter, the ability to kids to do pretend play is a great expansion of their ability to be able to speak. When kids can take objects and symbols and use them to create words so that they're using their imagination and their creativity, that becomes a great opportunity for kids not only to expand their vocabulary, but to take their ideas and to take their feelings and to turn them into ways of communicating. So anything that will help with pretend play, and especially getting down on the floor, and whether it's a tea party or pretending to race cars or pretending to do a scene from a movie, all of those are great opportunities to expand language and speech and get kids going and moving. And remember, even if your child doesn't necessarily have a lot of speech, you can still use that pretend play. You can still use your stuffed animals and your toys and everything to have fun with your child, to get them to be engaged in the activity, and then to bring out other ways of communicating, whether it's gestures or sounds or pointing, because eventually those will often lead to words. Sometimes parents worry that if my child is not speaking, if I teach them how to use sign language or gestures or pointing, that somehow that's going to interfere with their ability to do spoken language later. But that's not the case. Anything which allows a child to communicate will eventually lead to words if the child has that underlying capacity to be able to speak. And that's really the important thing. And it's really nice when it comes to communication that that's something you can do all day long with your child. You don't have to set up a 30-minute period here or a 20-minute period over here that you have to sit down across from the child and necessarily practice words and so forth. Think of all of the rich vocabulary that comes just talking over breakfast. All right? Think about all of the words and the sensory information and the back and forth communication that happens over meal times, or that happens when your child is on the playground and they're going up and down the swings and you're helping push them on the swings and the slides, and they're feeling the sand, and what does the sand feel like at the beach? What does the water feel like? This water is cooler, this water is warmer. Think about all of the rich language that occurs in those situations. So one of the best things about communication is that you can do it anywhere, anytime, any place. You don't need a lot of equipment. What you need is that joint attention. What you need is to be there with your child, and for your child to be paying attention to you, and you to be paying attention to them, and for you to learn about their signals, and when is the best time to speak and when is the best time to listen to your kids. And that's another really important issue too, because one of the things to remember is that when kids do get upset, if they do get frustrated, remember that that's a time when kids may not be able to process a lot of words. You may have to let a child kind of chill out, have some space, take some time away, rather than try to explain to them what they just did wrong. When kids are upset, just like adults, they lose that ability to process words and to really hear what it is you're saying. So remember, your words can really help kids get context and a sense of what the right thing to do is the next time. But at the moment that they're starting to get upset, you may have to use fewer words than too many words to help them out of a situation. Especially kids, again, that may have speech and language difficulties, and it's been hard for them to put their thoughts and feelings into words to begin with. I'd like to finish by just reminding everybody that communication is also something that kids can learn throughout the lifespan. Sometimes we hear the mistaken information that if kids don't learn to speak by the time they're 5 or 6, that they're not going to. Well, remember, it's not just about speech, but it's about communication. And kids continue to expand their ability to communicate and let you know what their feelings are in all kinds of ways, both verbal and in nonverbal ways. And that can continue to expand and stretch out throughout a child's entire lifespan. And if we can get words, and then we can help those words develop into sentences and help kids be able to express their feelings, then that's even better. And speech therapists and occupational therapists are just two of the professionals out there who are ready to help families and kids with that process if you need it.